Welcome to the Mystic Feminine Fertility Podcast, a sacred container for heart-centered conversations about fertility, pregnancy, menstrual cycles, and divine feminine energy. My name is Annalise Yagyajoti, and I'm a fertility awareness educator, a holistic reproductive health practitioner, and a modern mystic. It is my absolute joy and pleasure to host these conversations and share them with you. Welcome. Today, I am joined with Morganne. Morganne is a devoted advocate within the fertility and endometriosis community, committed to increasing awareness and offering vital support. Through her nursing and herbalist background and personal experience with endometriosis, she brings a unique perspective to the table. Her mission is to empower individuals with knowledge, resources, and a robust support system, which she offers through her fertility awareness classes and coaching services. Morganne, thank you so much for being here.
Yeah, thanks for having me.
Of course. So the first question that I like to ask is, where are you at in your cycle?
I am on cycle day 16 and I have not hit my peak day yet. So I'm still in that ovulatory phase. And for me, I'm feeling energetic, upbeat, happy. And yeah, I like this time of my cycle. There was a point in time where I did not like this part of my cycle, but right now I like this part of my cycle.
Why didn't you like this part of your cycle?
Well, so I have endometriosis myself, and for a couple of years, the ovulatory phase was really painful, and I didn't experience what a lot of people do. I just had a lot more flares. So I kind of almost dreaded ovulation, like a lot of people dread their period. But I no longer get those same symptoms, thankfully. And so, yeah, now I really lean in and enjoy this part of my phase.
That's
Or this part of my cycle.
That you, with the interventions that you've done, the work that you've done, that you've been able to get to a point where you can enjoy your cycle again and tap into, that sensation of ovulation. You said you're upbeat, you're positive. I mean, in theory, the ovulation phase is the best time to record a podcast because you're in your most external and kind of shiny. So now, when you were having pain mid-cycle or around ovulation, was that it was correlated with the actual act of ovulation?
Yeah, for sure. But it wasn't like I only felt it on one day. For me, as my period ended, I would usually have a few days before, so in my follicular phase, a few days um, where I didn't really have much happening, and then I would start to get this pulling down sensation that would last. Sometimes it just lasted a few hours, sometimes it would last a few days. And this would even sometimes happen before my point of change. So it could just be, but it would signal to me that, okay, some things are changing. And then sometimes it would be a week of pelvic pain. Sometimes it would be one day or a couple of hours. But generally speaking, I would get a set of symptoms that would come and last for at least a week. Sometimes worse than others, but yeah, definitely pelvic pain around ovulation. And it definitely would worsen on my peak day and the day after peak day. And then it would like significantly dissipate. But I would also get like pretty severe bloating, which people in the endo community call endo belly. I would get that around ovulation too. And digestive changes where it just felt like everything I ate, it felt like I was just digesting glass, and my stomach just constantly felt like this nervous type of anxiety and just like an unsettled thing. So all of these things were grouped together. So it wasn't just like the pain, but all of those things. Yeah, there's a lot that I could say there. I also would get mid-cycle spotting that came along with that pain. And sometimes it was pretty heavy bleeding, not just spotting. Other times it would be with a type of tissue as well. Sometimes it was just spotting, but there was, when my symptoms were at its worst, I would get a week-long period of week-long spotting around ovulation.
So you would have a week of different pains and discomforts around your ovulation. And then I'm also assuming excruciating pain that came with your actual bleed. And
Yeah, and sometimes the pain around ovulation was even worse than the pain around my period, which I feel like a lot of times people don't talk about that as much with
yeah.
endometriosis. But yeah, for me, a lot of times ovulation was a lot worse for me than my actual period. Not all the time, but sometimes it was.
Mhm.
And the pain that I would feel during ovulation was different than the pain that I would feel during my period. And the location would sometimes be different too.
Mhm. So you were saying around ovulation, the pain was more in the pelvic floor or in the pelvic pain? Hmm.
Yeah, so there would be different types of pain too. So even within like that umbrella of pelvic pain, there could be like, yeah, like pelvic floor, like crotch area pain, tailbone pain. And then below my belly button, like lower belly area, kind of midline, there'd be some pain there too. And then what I think is more associated with the actual ovary would be the left or right sided pain. And that would be like closer to my hip or even a little bit like higher towards like my waist.
Hmm.
And that would be like really sharp cramps that would come too. So yeah, lots of different types of pain that I would feel.
And how do those differentiate from the pain that you would feel on your actual bleed?
Oof. Yeah. So the pain that I would feel during my bleed was like this inner, like this pain from like my inner core, my inner being. The way I describe it, it's like there's this gremlin inside my core that is like pulling things in at simultaneously pushing things out. And it was like the worst pain I've ever felt in my life, where it's like it's so intense that you just can't even stand up type of pain. Whereas pain around ovulation would be more sharp and it would be coming and going. Whereas the pain with the period, it would start and worsen and worsen and worsen and then slowly dissipate. Whereas ovulation pain came in really intense, but then went away really quickly too. Um, and in my mind, it was always these like almost violent images would come up when I described the pain that I'd feel during my period. Whereas during ovulation, there were times where it was still severe, but a lot of times it's like this dull achiness. There would be sharp pain, but there would also be this underlying like heaviness and dull achiness. One of the parts that was more disturbing was that there just wasn't as much interventions that I could do to help the ovulation pain as there was for the period. And there's this natural endpoint to the period too. Whereas with ovulation, that's a little bit more unpredictable and yeah, unpredictable in my mind, not knowing when it would end, but also unpredictable, just cycle to cycle, when it would come on, when it would finish, and is it going to last for a day this time or a week this time? So mentally, it was a lot harder to get through as well.
Yeah. And I'm excited to dive into the emotional, the mental battle, as well as the interventions that you've done. But first, I want to take a step back for someone who might be
Okay.
listening and is like, has just been told that they may or may not have endometriosis. Can you start by just explaining what endometriosis is?
Yeah, so endometriosis is a chronic inflammatory condition, and it is where this abnormal tissue that is similar to the uterine lining, but not the same, similar, is found outside of the uterus. A lot of times people think of endometriosis as a painful period disease, and one of the symptoms, it can cause painful periods. But however, endometriosis is a whole body disease. It's been found all over the body in our bones and different organs in the brain. It's been found in males, it's been found in women after menopause, it's been found in babies who don't menstruate. So it's not a period disease, although it can cause painful periods. Some characteristics of endometriosis itself. So this abnormal tissue, it can develop these nodules. And there are three different like classifications of endometriosis. So there's one of them, it's DIE, which is deep infiltrating endometriosis, and those are the ones that cause those nodules. So this abnormal tissue can grow, let's say, on the outside of an organ like the bladder, but if it's this DIE type, it can embed into and infiltrate, so meaning it goes into that organ almost like a tumor would. And there's also cysts, so like ovarian cysts, which are also called endometriomas. They form large fluid-filled sacs, and those can be really large, even as big as a grapefruit. And then there's superficial endometriosis. And so that's more of like a cellular type, but it can also be large. It's just not quite infiltrated or causing these nodules, which is like this dense type of tissue. Regardless of the type, endometriosis can cause severe pain, whether it's infiltrated through an organ or not, it can cause severe pain. And one thing that is specific to the endometriosis tissue is that these tissues create their own estrogen supply. And that is important because endometriosis, some say it's like an estrogen dependent condition, but basically it just means that high states of estrogen can promote the growth of these lesions. So yeah, that's kind of like a introductory to what the condition is, but the biggest hallmark is inflammation, and it's that inflammation that's causing the pain.
I had no idea that they'd found it in babies and males, so that was super interesting.
Yeah, yeah. Not a lot of people talk about it, but to me, that's really significant because there's a lot of misinformation about endometriosis and a lot of outdated information. Like, for example, it used to be thought that endometriosis was caused by retrograde menstruation, where when you're having your period, instead of the blood flowing out of the vagina, it flows back out through the fallopian tubes and into the abdominal space. But if that were the case, it doesn't explain how endometriosis is found in males where there's no uterus.
Yeah. And even, I mean, I guess babies can bleed a little bit if they're female, but yeah, it's definitely not retrograde menstruation that we can we can rule out.
Mm-hmm.
I mean, and endometriosis is becoming more prevalent, or we're just becoming more attuned to it. But in our field, I feel like people are talking about endometriosis a lot now. And like you said, there's a lot of misunderstanding, a lot of outdated information. But even that outdated information, it's quite new.
Mm-hmm.
Is that accurate?
I'd say so, or at least the voices are new with
Yes.
the people that are speaking up about or speaking out about relevant research. But yeah, for the longest time, the amount of research done on endometriosis is pretty minimal. So the rate of like progress on research has been pretty slow. But I think that I think the big disconnect is there's not as many specialists and researchers dedicated to endometriosis compared to the amount of people that have endometriosis. And so I think that almost creates like an image of like a distortion of like the reality with endometriosis. But about 1 in 10 women have endometriosis, which is the same percentage of women that have diabetes. So it's like very, 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 very common.
Yeah.
But a lot of times people still don't really know what it is, which is kind of wild. But going off of that, there's a lot of practitioners that, because there's really not a dedicated specialty outside of surgeons for endometriosis. So I think we need more specialists and more research on endometriosis.
Absolutely. And why does it take so long for someone to get a diagnosis of endometriosis?
There's a lot of reasons why. I'll try to do my best to summarize kind of like the top reasons. Number one has to do with like a systemic problem, which is the lack of access and the barrier. So the only way to diagnose endometriosis is through a surgery. So just like cancer is diagnosed through a biopsy, endometriosis has to be diagnosed through a biopsy. And how do you get the biopsy is through surgery. A lot of times you'll hear this called laparoscopy. That is only referring to the surgical approach. But what has to be done is a surgeon goes in, removes the tissue, sends it to a lab. The lab looks at the tissue under a microscope and they confirm, yes, this is endometriosis, or no, it's not. A lot of times people will tell me that they had the surgery, but no tissue was even removed or sent to the lab. The doctor just looked at there was, okay, everything's fine. So one problem with that, so there's an access problem. So getting to surgery is a huge battle. You might not have a surgeon, you might not have the finances. transportation. There's a lot of reasons why somebody might not have the surgery. And then you get to the surgery and maybe it's missed. Maybe the surgeon looks around and they say everything looks fine. So they don't remove any tissue, they miss it. Maybe they're not specialized. And so the person really does have endometriosis, but they're told that there doesn't. So that can cause a delay in diagnostic time. So that's kind of one bucket, you can say, of like the lack of, or the diagnostic delay. Other one would be, the other one would be regarding symptoms and how women are perceived as patients, and this notion that period pain is normal. Because yes, even though endometriosis is not a painful period disease, that's probably the most well-known symptom, and that's a big warning sign that somebody has endometriosis, is this severe painful periods. And so if somebody has painful periods, maybe they tell their mom, and maybe their mom says, oh, well, that's normal, like, welcome to the club. Or maybe they tell their sister or their best friend, like, yeah, me too, we all have it, suck it up. And so that person learns from a young age, oh, like, this is what we all have. Okay, maybe I'm the problem. Maybe I just have a low pain tolerance. And so then they either don't advocate for themselves. It's not even really an advocacy. They were taught that that's normal. And so why advocate if it's normal? And then there's maybe people do think that something is really wrong. And they go to their doctors and they're not believed. And unfortunately, I hear this time and time again in women's health. I've seen this as a nurse. I've experienced it as a patient, but women face this double standard when we're going to, when we're working with doctors in the healthcare system, which is like, if you're a woman and you complain of pain, you're perceived as dramatic. But if you're not complaining of pain, well, then you're not actually in pain. Whereas a man, they're stoic and they're just like, have a really good pain tolerance if they're not complaining of it. And if they are complaining, then it's like, oh my gosh, they're in so much pain. So there's this, I don't have the word for it, but there's this like disconnect a little bit, or just a difference in the way men and women are treated when they go into healthcare. Then you add in periods, and for so long it was assumed and believed that periods just are painful, which kind of just blows my mind. If you think about it logically, it's like, when did we decide that a normal routine bodily function should be painful? Like, what? Like, we would never accept that for digestion. Painful digestion, that's a red flag. It should not be painful. Having a painful bowel movement or painful urination, those should not be painful. But yet when it comes to periods, we're like, oh, well, your uterus is contracting. Well, your bowel contracts when you have a bowel movement. Your bladder contracts when you urinate. So like, that doesn't really explain it. And yes, there are inflammatory substances that can lead to some type of cramping during the period, but doesn't explain why there's so many women out there that have zero period pain at all. So all that to say, one of the reasons why endometriosis takes a long time to be diagnosed is because really what I'm saying is women aren't believed. Women have these symptoms and they're just not believed. We go in and it's just assumed that we're being dramatic. Like, we come in and the baseline is, you're dramatic. So if you have such an invasive and expensive diagnostic process, it's going to take a lot of battle to actually get there to be diagnosed. So endometriosis it doesn't show up on ultrasound. It doesn't show up on MRIs. It doesn't show up in blood work. Sometimes people can have an ultrasound and their doctor will say they found endometriosis. What that means is that they found signs of endometriosis. So remember earlier I talked about there's a type of endometriosis that can appear like a cyst, like an endometrioma. That can be seen on an ultrasound, but all you're really seeing is the shape. You don't know what the cellular tissue is without a biopsy. So it's still not a confirmation, but a doctor could, after the ultrasound, a doctor could say, okay, with your signs and symptoms and with this ultrasound, you have endometriosis, but it's still not confirmed until somebody has surgery. So those are probably the biggest reasons. There's of course some others, but those are the biggest reasons why it takes so long. And on average, I see this statistic changing quite often, but anywhere from 7 to 9 years is what statistics say. For me personally, it took me 15 years to be diagnosed. I have a friend, it took her 16 years. I know some people, if you are experiencing unexplained infertility, your diagnostic time is usually half the time of other people, because
Mhm.
that's like a trigger to investigate for endometriosis. So people that have unexplained infertility, they might get a diagnosis faster, but half of 9 years, 4.5, it's still a very long time.
Yeah.
So regardless, it takes a very long time to be diagnosed.
Took you 15 years of
Yeah.
excruciating pain to even get a diagnosis, not even to start treating it, but to get that
Yeah.
diagnosis. And so
Yes. Yeah.
how old
15
were
years.
you when you had your first bleed?
I was 11.
11. So does that mean that you got your diagnosis at, let me do math, is that 26?
26. Yeah. Yeah. And at that time, I was already a nurse. I had been a nurse for almost 6 years at that point. And so I say that because I had an advantage by knowing how to navigate the healthcare system, having a little bit of medical nursing background to understand different signs and symptoms. So I knew, okay, it's probably not in this bucket of conditions. So I don't need to spend my time going down that process. Whereas, some people might. Initially, a lot of a lot of my energy was focused on digestive disorders, because the majority of my symptoms were digestive related, and that's actually not uncommon. Um, Statistically, it's about 90% of people with endometriosis first present to their doctor with GI complaints, not painful periods, but GI complaints. And the number one symptom is bloating. And so that's something that, even though like we have those statistics, it's still not that widely spoken about. And so you can imagine, if somebody comes to their doctor with bloating and digestive problems, their first thought might not be endometriosis.
Yeah.
Even though, from my perspective, knowing what I know now, it's like, okay, look at the whole picture. Of course it's endometriosis. But when you go into, especially when you go to a specialist, they're more likely to be thinking about celiac disease and ulcerative colitis and all these other digestive disorders, not necessarily endometriosis. Um, and I guess that kind of piggies on to another reason why endometriosis takes a long time to be diagnosed. And that's because the symptoms are so wide and varied that it can present like other types of conditions.
Mhm.
IBS, that's a really common one. People were told for years they had IBS, and then 10 years later, they find out they have endometriosis.
Yeah. I was rereading your bio when you were talking about your time in the Peace Corps before you knew about endometriosis, and you were talking about your time as a nurse and your own exploration, where doctors were saying, maybe it's SIBO, maybe it's cancer, maybe it's
Mhm.
like throwing out all these things. I mean, 15 years as someone who was already within the medical system.
Yeah.
And when
Yeah,
did,
it's kind of crazy.
yeah, I, I mean, my heart just hurts. Like, thinking about this and knowing that there's people navigating this still. And I do think that endometriosis is becoming more of a conversation, but yeah, this story isn't super uncommon. You were saying that your best friend, it took her 16 years to get diagnosed. 1 year longer than you. Was she diagnosed, or did she push for testing after your diagnosis?
This person, I don't remember exactly the process. I think so. She hasn't had excision surgery, but she has had the laparoscopy. Actually, I think she went in with like a ruptured cyst or something. She went to the emergency room, and then that's how they found it, if
Oh.
I'm remembering correctly. But yeah, I mean, both of us grew up thinking that period pain was normal. But going back to what you were saying about the long diagnostic delays, and just like how that is for somebody, like you mentioned, like your heart breaks. And I even find myself like talking about it from a little bit of like a disconnected view. And I know like it's almost like that was such a hard part of my life, that it's almost like, in order to be able to talk about it, I almost have to like put up these walls and intellectualize it and talk about like, like make it make sense. But like if I take a step back, um, and just like really talk about like the emotions and what was going on, it was really scary. Um, and I remember having a lot of anger and resentment when I did get my diagnosis, because it was like, why did I have to go through this for so long? It's like uh the years of gaslighting of like going into doctors, it's you're stressed out, you have anxiety, you're depressed, you have IBS. Like even when I would be having these severe pain, excruciating symptoms, writhing on the floor, and to be told that it's just stress. Like, how does a person not internalize that and make themselves the problem? I think for me, that was one of the hardest parts, like the pain aside, like, because that's its own type of like very difficult experience where you really become to you fear your own body. And I feel like that's again something that we don't talk about as much with endometriosis, but I know it's really common, where your body becomes this unpredictable thing and you have no idea what type of torment you're going to have the next day. um, and so like you have that going on, but then people that you trust, these medical professionals that are supposed to guide you, supposed to give you the answers, supposed to be your healers, they tell you nothing's wrong. Oh, well, your labs came back fine. Oh, like, and especially if you present as an athlete, as a thin woman, like I did, oh, you're so healthy. Even though I just gave them this huge list of symptoms, they would tell me, oh, you're so healthy. And so there's a lot of like inner battle, and it takes an immense amount of strength and persistence to keep going back to doctors and keep finding answers when time after time after time they tell you nothing's wrong. I can't remember the exact number, but I think it's like an average of 9 specialists a person has to see before they get diagnosed with endometriosis. It's either 9 specialists or 9 doctors. I'm pretty sure it's 9 specialists though, but it's just kind of wild about like how many times you have to get knocked down, stand back up, try again. It takes a cut on your self-esteem. It takes a cut on your own sense of reality, because you're told that the symptoms that you're feeling, you're dismissed. And so you start to doubt your own experience. And it takes a lot to recover from, symptoms aside.
Yeah, it's a major trauma and a chronic trauma. It's not a one-time thing. It's years of pain, of confusion in your body, of distrust, of not feeling safe in your body, and then having the external world kind of amplify that, whether it be, well-meaning medical professionals or well-meaning even family members who are just like, this is how it is, honey. It's like, oof, oof.
Yeah. When nobody else feels the pain that you feel, how do you know that yours is the abnormal one? You really have to trust yourself that no, something's wrong here.
Mhm.
Um, and not only that, but then there's so much work that goes on with being a chronically ill person and with endometriosis. Yeah, I mean, it's a chronic illness. And I remember, okay, there's this one time I was seeing a specialist and I prepared so much to get in to see this specialist. And I I didn't know yet that I had endometriosis. I suspected it, but it wasn't for certain. And so we were looking at this was after I lived in Zambia. So there was thoughts that, okay, maybe there's still some parasite thing going on. I know I have SIBO, celiac disease. There was all these like questions there. So I wanted to see a GI specialist, and I found like one of the best ones on the West Coast. I even ordered my own stool tests, did them myself. So I had the results ready. I had a food journal for a couple months. I've already tried the low FODMAP diet. I was already treating SIBO. So there was a lot of things I was doing. I remember after that appointment, I just sat in my shower and just cried for an hour because the doctor spent 10 minutes telling me how to chew my food. And I
Mm.
remember just feeling like these symptoms, and I was having rectal bleeding at the time too, right? So I was like, there's no way that these symptoms are happening because I just suddenly at 20, I think I was probably 25 years old, I didn't know how to chew my food, or I wasn't chewing my food. It's like,
What are you
okay,
eating?
yes,
Glass? Like,
you're right. It's like there's just I was not seen, I was not heard, I was dismissed. The level of effort I put in, it was just very discouraging. And yeah, and then you get to the friends and family, and like it doesn't make them a bad person for not being able to relate or understand. Um, but it adds to it when you're also not supported by friends or family, it can feel really isolating. Um, so like that's what on the flip side, one thing everybody with endometriosis needs is a lot of support because it's really taxing. And people's loved ones need support too, because endometriosis impacts people's relationships, impacts your family, because it really changes you as a person.
Yeah. Let's say that someone just got, they suspect that they have endometriosis, they're going through all these symptoms. What types of support can they be exploring?
That's a great question. Um, So for the like physical condition, seeing an excision specialist is going to be the best. So this is not something where you want to convince your gynecologist to do a surgery. You actually want to find a specialist. And so there is a directory called icarebetter.com, and they have a list of excision specialists. So that would be a place to start for that support for surgery. Getting in with a therapist. I mean, endometriosis, it's also associated with anxiety and depression. And like, of course,
Of course.
you can just think about it logically from like how it affects you. But there's also studies have shown that there's been some changes in the brain and there's also genetic changes that predispose somebody with endometriosis to developing anxiety and depression. So no matter how you look at it, somebody with endometriosis is just more likely, I think it's twice as likely, or maybe even more, to have anxiety or depression. So working with a therapist, that was one of the best things that I did for myself was see a therapist weekly, the times that I could afford it. And then if you can't afford it, finding some other way to support mental health, or that be journaling, self-help books. There are a lot of CBT books, getting into support groups. I know there's a lot um, of that available too. Um, Cycle charting has been something that's been really helpful for me. It gave me this sense of agency and empowerment back because through charting my cycle, I could predict flares. And by doing that, I could set myself up, use the right tools, and then prevent flares. So that just gave me a sense of order and control and predictability over a body that suddenly was no longer predictable. And helped me in so many levels too. So psychocharting would be a good support. And then a lot of people with endometriosis can benefit from working with a pelvic floor physical therapist.
Mm.
So and that shortened, it's PFPT. And that's for anybody with pelvic pain, abdominal pain, urinary dysfunction, diarrhea, constipation, so it's not a lot of times people think of it as something you need after pregnancy, but no, it's actually really helpful when your pelvic floors are overly tight as well. Because that can cause painful sex. Just pain walking can cause random pelvic pain. So, or pain when you're sitting for a long time. So PFPT is really helpful. Some people might need a dietitian or nutritionist for some dietary support. Some people could benefit from acupuncture. That's one of the things that I do and I still do consistently. It's something it's helped me on multiple levels. Physically, I feel so much better. It was the first time I felt safe with a practitioner. And
Mm.
it also gave me this sense of agency and comfort, knowing that no matter, we don't need a diagnostic test to be able to treat me now because it's all symptoms based. So I really liked that. And herbs. Herbs is something that I've also worked with. Another thing that made me feel empowered and gave me a sense of agency back, because there's just not a lot of great options when it comes to pharmaceutical medications, in my opinion, without, or at least not good options that don't have negative side effects. Whereas with herbs, I've been able to manage a lot of symptoms or eradicate them entirely without causing side effects. So yeah, that's kind of like a good starting place. And then symptom specific, people might need other types of support.
Yeah, that's a fantastic list. And I love that you brought up acupuncture. I think it's such a wonderful tool. And like you were saying, it's one of the things that like you don't need to actually go through the surgery of laparoscopy. Um, because you're in pain. So they're not necessarily treating the endometriosis. They're looking at the body from a completely different modality. They're looking at the meridians, the energy flows, the balance of elements in the body.
Mhm.
And it sounds like you use it in complement with other treatments. It's not like
Yes.
the
Yeah.
only thing that you're
And
doing.
so for myself personally, I never went to acupuncture until after I had excision surgery. So I
Mhm.
don't have the experience to say like if it would have helped regardless of surgery or not. Personally, I don't quite think so just because of the like how big and invasive endometriosis can be. I think
Yeah.
there is a time and place for surgery, especially for me and where my endometriosis was located. However, um, I think that acupuncture, yeah, it treats the whole body. And like I said before, endometriosis is a whole body disease. And with Eastern medicine, specifically Chinese medicine with acupuncture, it's pretty much impossible to separate the mental state from the physical state. And
Mhm.
that's really, really cool because we don't see that much in Western medicine. And I really liked that myself, that like I could go in and I could be like seeing my acupuncturist for pelvic pain, and be like, you know what, I'm also having a lot of anxiety, or I'm going through a lot of grief right now. And they would put in points for that. Or maybe it's still physical, but maybe it's like, oh, and I also had a rash, and I'll show them this. Like, it just treats the whole body, which is really nice. And then, like I said before, about feeling safe. So, like, there's this like mental, spiritual aspect there too, where like just my whole body, like all of me felt good. And I strongly believe that you cannot heal in a place where you are not safe, whether
Yeah.
that's whether you feel that way or you actually aren't safe, regardless. I think you need to be feeling safe for your body to be able to heal, because we can, think about it, if we need to like intellectualize it, think about the nervous system and the hormonal changes that happen when you're in a fear response, but also just very simply, like it's hard to heal if we don't feel safe.
Mhm. Yeah, it's so important to find spaces and people with whom and in which you feel safe.
Yeah,
And
for sure.
there's a lot of benefit to exploring, Eastern modalities and even getting into the woo woo, as people like to say. Whatever is going to make you feel supported and safe in your journey. I know a lot of people have had success with, yoga, meditation, Reiki, energy healing, various types of just holistic support are phenomenal
Yeah.
to explore. But I want to redirect back to kind of the timeline of someone who's on this journey.
Hmm.
So, normally people will start to present symptoms and then they go
Hmm.
through the exploration phase of trying to figure out what is wrong with them. After you said an average of 9 years, someone gets a diagnosis. And then what?
Yeah. So if ideally the diagnosis happens at the same time as treatment, so you'd see a surgeon who can do excision. So when it comes to endometriosis, there's two main types of surgery that you'll hear about. And one is ablation, the other is excision.
Mhm.
Um, and a lot of times people think like ablation is using a laser, and then they get confused when they see videos of doctors using a laser to excise. So ablation isn't just about using the tool, a laser, but it is burning away the cells at a superficial level. Whereas excision, they do something that's called like a wide margin removal, where they're taking away the abnormal tissue as well as portions of healthy tissue. So they're cutting around the endometriosis lesions and removing all of that. So it's around it, but also going deep and under. So I think the best example I've seen people give is if we think about weeding, if you're just cutting the grass, that could be like ablation, where um, the grass just comes back. But if you're weeding and you actually pick up the roots, then that whole plant is gone. And that would be like the excision. So
Mhm.
the idea behind excision surgery is to get all of the abnormal cells out of that area with the hope that it won't come back. Whereas with ablation, because the lesions haven't been fully removed, they just you end up having scar tissue and having internal wounds all over your
Mhm.
body essentially. Um, but then there's scar tissue and adhesions and ends up being more pain afterwards. And then the endometriosis is still there.
Mhm.
Whereas with excision surgery, there still is a risk of scar tissue formation and adhesion formation, but endometriosis is removed. And so ideally the goal is that when somebody gets diagnosed, they can be treated at the same time. Sometimes, so statistically, people have their second surgery within 5 years. The majority have their second surgery within 5 years. And that's not a perfect statistics because not everybody with endometriosis goes back and has another surgery. So for myself, it's been 3 years since I've had my surgery, and I'm not at a place where I think that I need to have another surgery, which is amazing. But if you asked me in January, I was questioning that. I was having a lot more symptoms then. So endometriosis can be dynamic. So there's no cure. So even getting the surgery doesn't mean that you're never going to have symptoms again or that all your symptoms are going away. Because we also know that there is changes with the immune system. So it causes immune dysfunction. We don't see that surgery automatically fixes that. Then you also have endometriosis that has been in the body, that alters the nervous system, alters the musculature. So there's other things that have to be treated as well. And all this can vary person to person. But need all that to say that after surgery, the journey doesn't end there. Actually, in a lot of ways, the journey begins there because now you know what you have, and then you can start treating all of those things.
Mm-hmm.
And there's some nuance there because for some people, they might feel totally fine and never think about endometriosis again after their first surgery. There are people that have what's called silent endometriosis, where they don't have any symptoms but infertility.
Mm-hmm.
And so after they have their surgery, they might not need another one. If having the surgery removes the endometriosis, restores fertility, they get pregnant, have a baby, and then they don't have other symptoms, so there's no reason for them to go back to surgery. That would be somebody that maybe for them, they're not doing more about endometriosis in their body. So it's very variable and kind of symptom dependent and person dependent. For me, I think like ideally, once you know that you have endometriosis, then you're making changes to live an anti-inflammatory lifestyle, which can look very different for everybody. But yeah, I'd say that other than having a repeat surgery, what happens next really depends on what symptoms a person has and what other co-occurring conditions they have. Somebody that has adenomyosis, for example, they might go back and have a hysterectomy. Whereas somebody that has somebody might have other conditions and that might kind of change their path as well. So it's hard to say for sure, but usually there's still a long process and a lifetime of management.
Mm-hmm. I like that you brought up the anti-inflammatory lifestyle because that's what it is. You're looking at, how are you eating? How are you moving? How are you sleeping? Are you getting enough water? It sounds like you work with herbs a lot, with both, various herbs and then potentially Chinese herbs from acupuncture itself, helping with the inflammation, lowering stress, spending time in nature. Is there anything else that you would add to that list in terms of reducing inflammation?
I think a lot of times we don't think about the mental health when it comes to inflammation, but in Ayurvedic medicine, they do. I think it's ami is the word for it when there's like this congestion of like this mental stuff. And so that can be like associated with inflammation in Ayurveda. And so I also would think about like, working with a therapist and journaling. And if we think about it like from a biological perspective too, if we're having a lot of internal stress that we're not processing, that can lead to inflammation if we are in a sustained stress response. So our body reacts to stress physically and emotionally the same way hormonally. It's creating the same type of response. So I think there's a lot of focus on the physical, not as much on the mental and emotional, but those things need support too. So learning how to process feelings, not just intellectualize them, but learning how to actually process them, and setting boundaries, time for pleasure and for fun is like another thing to add in too that can help with, and spending time with friends. That's another thing that um, is an easy and fun way to lower inflammation.
I love that. Yes, adding in the full body, the mind, the body, the spirit, doing, because it's a full body approach, it's a full spirit approach. In a lot
Yes.
of these Eastern modalities, we see the body as the physical manifestation of thoughts and emotions. And so in yoga, there's a lot of, that's the modality that I come from in my background. There's a lot of talk about like sitting with your emotions, moving your emotions, like breathing into them before they can manifest in the body as additional dis-ease,
Mm,
as discomforts or ailments. So I think that's such an important point of like, feel your feelings, learn how to
yes.
release them, find people
Yeah.
who you feel safe navigating your emotions, your feelings with, because the intellectual side of any illness or wellness or any of it, it's great. It's great that we have this information. But really, I believe that healing comes from within the body. But it's hard to get into your body when you're in pain and you're afraid of your body. Like that's
Yeah.
hard work.
Yeah.
And the body
Yeah.
also, we're talking about, the womb. We're talking about this giant energetic center in our bodies. It's our connection to the ethers and to the earth. We are the conduit. Whether or not we choose to bring children into the world, we are the space in between heaven and earth. The womb also connects us deeply to our ancestors and to our ancestral line. So, one thing that's come up for a lot of my clients who are navigating endometriosis is this concept of ancestral healing. And a
Mm.
lot of them begin to look at their relationship with specifically their mother and their grandmother and the women in their maternal line. Is this something that you've, heard of or navigated yourself?
I've heard of it very vaguely, just like the concept. And it's not something that I've worked with or I've navigated, but just thinking about it, I can see some parallels and some connections there too. And if we do want to kind of intellectualize it, like we are born with all of our with all of our eggs and our ovaries. And so it's like there are things that are going to be passed down generation to generation to generation.
Absolutely. And so endometriosis can be a tool, or not a tool, but an entry point to looking at this ancestral trauma with the people who have come before us. But also, like you were talking about, this connection with fertility, it often brings up these either questions or struggles about the even the ability to bring in new life. A lot of people with
Mhm.
endometriosis are trying to have children or would like to one day.
Yeah.
Do we know why endometriosis impacts fertility?
Yeah, there's actually very clear ways that it impacts. I think if somebody doesn't really understand what fertility is and can't really conceptualize it, it might be very confusing. But when you understand exactly like what's happening, then you can almost guess like some of the ways that it can that it can impact it. So we've already talked about endometriosis as causing lesions, and sometimes it can invade into organs. And so one way that's like a very easy to understand way is if you have a lesion in your, let's say, fallopian tube, that's a place where fertilization happens. So that's where the egg and the sperm meet to form an embryo. So if there's a lesion there and the egg and the sperm can't meet, you can't even get pregnant naturally because of that. So that's one way. And so that would fall under lesion location. Another cause is ovulatory disturbances. And so that's like an umbrella term. There's different types of those, but something is wrong with ovulation. And so if you're not ovulating, well, then you don't have an egg. If there's no egg, you can't get pregnant. So in that way, it can cause impacts with fertility. Another way is the immune dysfunction piece. So women with endometriosis have been found to have an elevated lymphocyte, which is a cell in the immune system. It's one of the fighter cells. And so women with endometriosis were found to have higher levels of these in the uterine lining. Uterine lining is where implantation occurs. So that's where a fertilized egg implants and starts to grow and then the placenta builds. And basically that's where pregnancy is held in that space. So if there's a lot of inflammation caused by the immune system there, it can reject that pregnancy and cause a miscarriage. And so what happens naturally, the body is extremely smart, extremely wise, and we naturally lower and suppress our immune system during the time in the cycle when pregnancy is possible. With people with endometriosis, those changes don't happen the same way. And so the body is more reactive. And so miscarriages are more likely to happen. Another way that miscarriage could happen with endometriosis. So maybe the problem isn't actually getting pregnant, but keeping the pregnancy. And so that could fall under the umbrella of fertility, because it's we're talking about all about the ability to conceive and to become pregnant. And so if the pregnancy doesn't actually last, well, that's still impacting fertility. And so that could be a cause of miscarriage, could be this increased contractility. So basically um, the uterus is acting a little bit crazy, where it's not staying nice and calm and stable, but instead it's contracting a lot. And this can be due to inflammatory substances that the endometriosis lesions let out. So even if you have endometriosis elsewhere, because it's found outside of the uterus, those systemic substances still can impact the uterus and cause it to contract more. So that can cause a miscarriage. Other things that could cause it are scar tissue and adhesions. So people with endometriosis are more likely to have scar tissue and adhesions because of either having surgery or having endometriosis itself. Basically, I think most people probably know what scar tissue is. Adhesions is when it's like a gluey substance that binds two structures together that shouldn't be bound together. So if you ever think of, like, if you stepped on a piece of gum and you're lifting up that shoe and the gum, it's really stretchy but bound together. That's kind of what an adhesion looks like. So that can restrict mobility of the internal organs, and that can prevent the egg from the ovary entering the fallopian tube. It can prevent the fallopian tube from moving around and reaching to catch the egg. So it can impact fertilization in that way. And then there's other things like hormonal imbalances that can lead to also an early miscarriage that way. So yeah, those are kind of the main reasons. I think that's pretty much everything. And then inflammation, that's like a big global umbrella, but it can impact fertility that way too. So that's a lot of ways, but which can sound like scary and overwhelming, but the good part is there's things you can do about all of those things. I think a lot of times when we hear about infertility, it's like this life sentence or like this fate. It's like, oh my God, I'm infertile. Okay, like I guess like there's nothing I can do, or I have to have IVF. But there's one thing I wish we had more words around fertility, because we don't have a word to distinguish between short-term infertility and long-term / permanent infertility. Same thing with fertility. We don't have words that describe the natural times in our cycle where we are fertile, and then the long-term state of being type of fertile where you're capable of getting pregnant. With endometriosis and how it impacts fertility, in a lot of ways, it's not a permanent type of thing. For some people it can be, but it doesn't have to be. If you have a lesion that is binding your fallopian tube or adhesions and you have that surgically restored, well then endometriosis should no longer be impacting fertility that way. Therefore, pregnancy could still happen. And we see that fertility rates actually rise after excision surgery, because once you treat the endometriosis, then fertility is improved and restored.
Yeah. If we know these points of difficulty in the fertility journey, we can start to treat them. We can start to address them. I'm curious with scar tissue specifically. I meant to ask this earlier. Do you know any connection between healing scar tissue and any sort of like abdominal massage?
Yeah, I've heard a lot of pelvic floor physical therapists recommend doing that after surgery. A lot of therapists actually will say to go see a therapist before surgery, get your body prepared for it. Surgery is a trauma, and start doing things to repair and then going afterwards. So my physical therapist taught me abdominal a massage to kind of mobilize the scar tissue because I
Mhm.
started going pretty quickly after my surgery. Um, there's also um, there's also some medications that are given to help prevent the buildup of scar tissue. And there's also surgical techniques and applications that can be used. So there's something called Gore-Tex that the surgeon can place on in the abdomen during surgery. It stays there usually for like a week or so, and then you go back in and you have it removed. And that's mostly to prevent adhesions, actually, um, not necessarily scar tissue. But yeah, I have heard of abdominal massage to reduce scar tissue. But there's also some people are just more prone to developing like this like hypertrophic, so like an overgrowth of scar tissue than
Mhm.
others. And I haven't seen that abdominal massage can like entirely prevent that.
Mhm.
But just by bringing circulation to the area, improving blood flow and the the lymphatic system, it just makes sense that it's going to be helpful. So yeah, in my opinion, I think everybody should be doing that after surgery.
Yeah. Yeah, I think abdominal massage, whether it's, with the physical therapist or Maya abdominal massage or our Vigo, there's so many different modalities now of bringing, the movement of energy and blood flow into the abdominals to the womb to all of these areas. And I think it's so beneficial no matter what's going on, even if there's no
Mhm.
negative symptoms. The other thing I wanted
Yeah.
to ask your opinion on, since you work with herbs,
Mhm.
is yoni or vaginal steaming. Is that something you have an opinion on?
Say more. I think it kind of is one of those things
Oh,
where it depends. Like if you have specifics, I'd love to dive into
yeah.
it. But kind of like globally, if somebody is like, I have endometriosis, and somebody tells them, oh, do like yoni steam or something.
Mhm.
Uh, I'm I'm not going to put all my eggs in that basket and hope that it's going to take away all of my symptoms and cure everything. That doesn't mean that it's not helpful at all. Like there's a
Mhm.
middle ground there. I think a lot of times when people hear that, they're like, oh, so let's like get rid of it. No, it's not what
Mhm.
I'm saying. I just don't think it's going to be like the magic bullet, kind of like how people talk about like superfoods. And then we're like, oh, it's just a fruit or vegetable type of thing.
Yeah, like
I'd
maca
say,
sticks to turnip.
yeah, it's one of those things where, um, I'm a very simple person, and I think kind of I like to look at the big picture. And so there's probably other things this person isn't doing that they could do that would have more impacts. Like how's their sleep and how's their diet and are they eating enough? And there's probably other things that I would want to look at first
Mhm.
before I would think about the steaming. But there are certain cases like yeah, like for specific issues, then that would be something like, oh yeah, that's like a direct applicant, very specific and easy way to get the herbs to that localized area. So there are times and cases where it would be appropriate and more effective, but for the average person, just kind of globally,
Mhm.
take it or leave it, I think.
Yeah, the when I've talked to people with endometriosis about steaming, it's all been anecdotal. But most of the people that I've talked to who do steam right around their period, so in the days leading up to the bleed and right after the bleed, they have told me that they have, less pain, less bleeding, and that for a few people, they have told me that it has been able to extend the time in between excision surgeries.
Mm.
But being mindful of which herbs that you're using and taking in all of the accounts. For anyone who doesn't know, yoni steaming, vaginal steaming, it's the ancient practice of sitting on top or above a bowl of hot water with medicinal herbs. And so not only is it introducing the herbs into your body, but it's also creating a sense of relaxation in the nervous system. As the cervix can be the base of the nervous system, we're softening it with steam. Like we steam our faces and other parts of our body, we can also steam the yoni. Definitely not a one size fits all, fix all solution, but I've seen that be very beneficial for certain individuals.
Yeah, and that makes sense that it would, also thinking just about increasing circulation to the area because heat brings blood, which we want. blood heals things, it provides the nutrients, it removes the waste. So, well, the lymph removes the waste, but it's just from that lens, I could see that it could be hopeful. And yeah, it's a traditional practice, and there's a reason why those things have been done for years and years and years and years. So I think there's like a lot of wisdom with that as well. It's not something that I personally do, but I have certainly studied it and have read about it before. So I know that it can be beneficial, but yeah, I would still, it's about that person's capacity too. And
Mhm.
sometimes people are too overwhelmed to add in new things. And in that case, I would say that the steaming could be something that could be let go. But if somebody's able to add in more and they're looking for extra support, then why not? I think give it a
Yeah,
try for sure.
beautiful. In terms of the fertility conversation, is there anything else that someone who, has either suspected or confirmed endometriosis and is wanting to conceive ASAP, is there anything else that you would recommend them either doing or looking into?
Ugh, when you said ASAP, my heart just kind of sunk. I'm like,
I know.
say the first thing is checking in on the expectations. It's okay to want that, but also bring in a little bit of like, how are you going to handle that if it doesn't happen right away? Unfortunately, I've seen a lot of women go through so many painful procedures and sometimes unnecessary procedures because they just want a baby right away. And that's totally their choice. But sometimes, and people will tell me this afterwards, they're like, I would have done anything in that moment. And like, I wasn't thinking clearly. So this is not my judgment on them. This is what
Yeah.
people have told me is that like they weren't thinking clearly. So just to like protect that person and like their future self, I would say like sit with those expectations a little bit and like see if you can like navigate both. Like, okay, I want this, but this might not happen right away. How am I going to handle that? So that's kind of where I would start actually. And then really the best way to evaluate your fertility is through your cycle chart. So if you're not charting your cycle, start. Because that's going to give you the clear direction and that's going to cut out a lot of unnecessary steps and yeah, it's going to give you the best direction. It's just like if somebody's having heart problems and they get an EKG done, well, that tells the doctor, okay, let's do this intervention or let's order these labs and this treatment would be good for them. Our cycle chart does the same thing for us. It can identify points in the cycle that need more support, things that are off, and that can direct your provider to order specific tests. One that's like really easy to look at through a cycle chart is low progesterone, and low progesterone is one of the main causes of a miscarriage, and so that's like an easy thing to fix. um, Other than that, if somebody hasn't yet seen a excision specialist, that would be my next thing. Because like I said before, fertility rates improve after excision surgery, which makes sense because we're actually treating the endometriosis. So that would be the place to start. And honestly, realistically, I'd be doing these things kind of simultaneously. I'd be thinking like, okay, I need to go see. This is not like an order of steps. It's like, okay, like I'm going to schedule that appointment. I'm going to work on my expectations. I'm going to chart my cycle. Like these are things you're doing kind of all at once to move you to where you're going.
Mhm.
And then from there, a lot of times people with endometriosis are on birth control because maybe that's the only thing that has helped their symptoms or because that was what their doctor told them. Certain countries, the healthcare system mandates you do birth control before you can go to surgery.
Oh,
So yes. So there can be like barriers with that way. So if you're taking birth control, obviously you would have to stop that to try to conceive, but you would also need to give yourself some time to replenish the body because hormonal birth control, and when I say hormonal birth control, I'm talking about like the pill with synthetic estrogen and progestins in it. There's lots of types of hormonal birth control, but that's the most common. And it can deplete the body of nutrients and minerals that are needed during a pregnancy. And so giving yourself some time to kind of restore your body and build it up. 6 months is like a great time. So keeping that in mind. And then other than that, it would really depend on what what that person is seeing. I really, for me, it comes back to the cycle charts. Like, well, what's going on with their cycle chart? Is the problem with ovulation? Is the problem with progesterone? Is like, where is the problem at? Or inflammation high, hormonal imbalances. So yeah, coming the cycle chart is really going to direct you so you can know exactly what you need to do. Because if you Google things to do for endometriosis to improve fertility fast, well, endometriosis affects people so differently that
Yeah.
you might get good responses, but they might not be applicable to you. But your cycle chart is because it's literally yours. So that would be, I think, the most helpful place to start.
Yeah. Those are phenomenal tips, very realistic. And
Mm,
I think, yeah, that managing of expectations is a good practice, but also coming back to this idea of conception,
mm,
like it's physical, yes, but it's also very spiritual and energetic. When we're
mhm,
creating life, like it is a spiritual journey.
mhm.
And all things happen as they're meant to. It's all a part of your process, your journey. Is there anything else that you would like to share about endometriosis or about your journey before we kind of start to wrap up and hear about what you're doing and offering in the world?
Good question. I'd say like I just to reemphasize finding a good excision specialist because this can save people a lot of time in their endometriosis journey. So just for like more context, the time that met with a specialist to the time that I was diagnosed was 2 months. Can you imagine if I
Mhm.
had seen a specialist years ago, like how much would have changed? It's just wild. Um, an endometriosis excision specialist, they only work with patients with endometriosis, whereas a gynecologist, they're delivering babies, they're doing pap smears, they're working with STDs, they're doing so much. They just do not have the time to become an expert in endometriosis. Where an excision specialist, that's all they do is work with patients with endometriosis. So you can kind of see from that lens, like why they're going to just have more, they're going to be more capable of providing you with better care. And with surgery, you really want to have somebody that knows their stuff. So this is the one time and place that I would say, like, really prioritize that. And sometimes that means that you're going to have to travel. Sometimes people have to go to different states, even to different countries. It is incredibly expensive. So look at your options and take advantage of the resources that you have. Some doctors will offer free case reviews, even over telehealth. So you can meet with them before you even have to drive to a different state to meet with them. While so like doing that while also attuning to your emotional and mental health. I think that's super, super important. And allow yourself the time and place to grieve. I tell people that endometriosis changed every single part of me. I lost every single part of my identity has changed. I'm an entirely different person because of endometriosis. And there are things that I don't like about that, and that's okay. Like for me to sit in the reality of it, I don't have to like it. I just accept and acknowledge like that's what happened. Um, but I fully believe that I'm better off having grieved through it rather than kind of ignoring it and pushing it aside, pretending that everything is okay. So give yourself the time and space to grieve and try to find people in your corner that will support you and be with you throughout your journey. And you don't have to be alone. That's the thing. Like there's so many great people out there that can support you through your endometriosis journey. So yeah, definitely like that's one way you can really take care of yourself is finding that support.
Mm. And speaking of those wonderful people that can support you in your endometriosis journey, Morgan, what are you currently offering in the world? What are your services?
Yeah, so I have a business called Fertility Defined. I teach fertility awareness classes. I do them, and it's all online. I do one-on-one classes. I also have a coaching service where there's two coaching packages. One is primarily only endometriosis, so you don't have to cycle chart, but if you just want support working with endometriosis anywhere on the spectrum, from getting diagnosed to managing symptoms, I work with people with that. I also work with people um, coaching with it's like a women's health coaching essentially with cycle charting. So if you do have like painful periods or painful ovulation, and you want to support those things holistically, like herbs, lifestyle, supplements, that type of thing, then I have a coaching package for that. And then I periodically do online classes. So this one will be already passed by the time this launches, but I'm teaching a class on herbs for the menstrual cycle next week. But I will be doing stuff like this periodically. So, stay tuned for that type of stuff if you just want to join for some classes. Yeah, so that, and then on the flip side, I'm a writer. I don't talk about this as much, but I write all about women's health things too and nursing. So my nursing hat is on. I'm doing a lot of like writing and health education through writing online. So that is kind of what I'm doing and what I'm putting out there.
Amazing. And where can people find you?
Yes, so I am on Instagram at Fertility Defined, and then my website is the same, fertilitydefined.com.
Awesome. And those will all be in the show notes. Thank you so much for coming on, Morgan. You are such a wealth of information, of lived experience. And I have been so grateful over the past years of my career to have someone in my network that is so knowledgeable and experienced in endometriosis, but also like embodied, kind, and heart-centered in it. I really deeply appreciate how you don't try to bypass the internal, the emotional experience of it, because that's such a big part of it. So I thank you so much for your work in the world, for your experience, and for taking the time to come on.
Oh, thank you for those kind words. I really appreciate that. And yeah, you're right that there is just so much of an internal part that goes along with endometriosis. So bypassing that would be, not presenting things as they really are. So yeah, I like to hold space for all of that and support people any way that they can. That's one of the reasons why I became a certified fertility awareness educator, was to provide that type of support that I wish that I had going through it. So yeah, but thank you for having me. It was so great to be on here and to chat with you.
Thank you so much for taking the time to listen to this episode. If you enjoyed it, it would mean the absolute world to me if you'd share it with someone else that you think would like it, or leave a review. You can learn more about our guest by reading the notes below. And if you want to learn more about me, my one-on-one coaching, my memberships, or my online courses, you can learn more at mysticfemininefertility.com or Mystic Feminine Fertility on TikTok and Instagram. Have a wonderful rest of your day, and I look forward to seeing you in the next episode.